So you've been told that you only have one functioning fallopian tube. And now you're wondering, can I still try, quote unquote, naturally? Can I do IUI? And the answer is yes, absolutely. As long as the one tube that you have is open and functional, you can still get pregnant with timed intercourse or even IUI. But let's get into the details because this is one of those topics that's filled with tons of myths and confusion. Here's what most people get wrong. They assume that having one tube means that you're going to have a 50% drop in your fertility, and that's actually not the case. First of all, ovulation does not alternate evenly between both ovaries every month. It's not a perfect 50-50 split. Some people ovulate more often from one ovary than the other, and sometimes you're going to ovulate from the same side for multiple cycles in a row. It's completely random. So missing a tube on one side does not necessarily mean that you're missing out on half of your chances. Secondly, even if you ovulate from the side without a tube, pregnancy can still be possible. And this is actually really cool. This is due to something called contralateral pickup, where the remaining tube that's in place can actually pick up an egg released from the opposite ovary. The reproductive system is more flexible and adaptable than we give it credit for. So working with one tube does not reduce your chances by 50%. The reduction is actually more realistically between 15 and 20% overall. Now, it is important to understand where the blockage is in the tube and what type of blockage it is, and if the tube looks damaged. This is where one of the illustrations from my book, The Lucky Egg, comes in handy. It's important to understand where the tube is blocked. If the blockage is what we call proximal, meaning at the junction between where the tube meets the uterine cavity, 60% of the time, this is going to be a false positive. This may show up as a blockage on an HSG because of the muscle in the uterine area that can actually spasm. And there could also be like a mucus plug. So in the case of seeing a proximal blockage on imaging, we can take a closer look by doing a repeat HSG. And we can also do something called selective salpingography. And that involves at time of HSG using a small catheter and a guide wire to gently investigate and potentially open up the tube. And listen, if it is a true proximal blockage that is preventing communication between the tube and the uterus, then you can still do timed intercourse or IUI as options as long as the remaining tube is open and functional. Now, if the blockage is distal, meaning at the end of the tube, then that may be a different story, especially if the tube has back pressure and is dilated and damaged. This is called a hydrosalpinx. If it's filled with blood, especially in the case of endometriosis, that's called a hematosalpinx. And that fluid is toxic and inflammatory. It's toxic to embryos. It can lower implantation rates by 50% and double the rate of miscarriage, especially early first trimester miscarriage. So it is not helpful to keep that tube in place. It can actually be harmful. And this is why we often will recommend removing a dilated, damaged tube, a hydrosalpinx, or at the very least, sealing it off from the uterus, which can be done with surgical clips or even coils. This reduces inflammation and can significantly improve success rates with IVF by improving the uterine cavity environment. So if you've only got one fallopian tube, know that you're not out of the game. It's all about understanding where the issue is and how to best move forward. Ask your doctor the right questions, and remember, one good tube can often be more than enough.